All right, I think we can start. Good day, everyone, and welcome to this webinar on Youth Participatory Action Research organized by the Children and Families SIG of ISBNPA. My name is Sanne Veldman, and I'll be facilitating this webinar today. We'll have two speakers, each of which will present for about 15 minutes, after which there'll be time for questions. To prevent any noise and distractions, you will all be muted, and we kindly ask you to share your questions with us throughout the presentation using the Q&A box. You can just ask your questions whenever you come up with them so you don't forget them. You can find the Q&A box at the bottom of your screen, and once the presentations are finished, we will address all of your questions. So moving on to today's speakers, our first speaker is Dr. Teatske Altenburg. She's a senior researcher with the section Child Health and Care Research at Amsterdam UMC. And she's interested in research related to youth physical activity and sedentary behavior, and examines behavioral patterns and how they can be improved to maximize child health. As children are the experts of their own lives, she collaborates with children to conduct her research. Our second speaker will be Manou Anselma. She's a PhD candidate at Amsterdam UMC, and she's working on the project Kids in Action. In this project, she collaborates with children to develop, implement, and evaluate interventions to improve their health behavior. And in her project, she applies youth participatory action research, and she will further elaborate on that during this webinar. So good luck to our speakers and enjoy this webinar.
Thank you, Sanne, for introducing us, and welcome everybody to this webinar about youth-led participatory action research. Okay. One moment. Presentation is not working as it should. There it is again. First of all, I would like to declare no conflicts of interests. I would like to start with the definition by Baum et al., indicating that participatory action research aims to improve health and to reduce health inequities through involving the people who in turn take action to improve their own health. So I will start this webinar by explaining a bit more about the wording participatory action research. And after that, Manou will take over and talk more about youth-led participatory action research. People who experience a problem are in the best position to conduct research on this specific health issue or problem. Thus, they should be involved, actively involved in research, in the whole research process. And essential in this research process is that there is an equal collaboration between the researcher and the participants. With that, I mean that there is mutual learning and also shared decision making. So participants could learn research skills from the researcher, and the researcher could learn about the situation of the participants. And together, they shape the research process. So participants work with a facilitator to identify a community problem, develop research methodology, collect data, and analyze findings. And in this process, experience is the basis for knowledge. I would like to point out that the degree to which active involvement of participants is possible may depend on the research, on the type of research project. And I would like to point out and share an example where 9 to 12-year-old children are actively involved in the research, but they do not have a role in the decision-making throughout the process. So this research I refer to is My Daily Moves. And in this project, we aim to develop an instrument where we measure physical activity in 9 to 12-year-old children. And in this research, we use various participatory methods, such as concept mapping and photo voice, in order to obtain information on all daily activities that children perform, the frequency of these activities, and also the intensity, the perceived intensity of the activities, as well as the setting in which these activities are performed. Based on this information we got from the children, and as well as the information we got from systematic reviews, we built the measurement tool, And in discussion groups, we discuss with children about whether the tool is comprehensive, it's understandable, and all relevant items are included. Based on the input of the children, we improve the tool. And yeah, it's important to understand that so we do collaborate actively with these children. They do not have the power to make shared decisions. So we don't refer to participatory action research because shared decision making is aspired in participatory action research. So a second key aspect of participatory action research is that it aims to enable action. So the process of PAR should be empowering and should lead to people having increased control over their lives. So the focus of participatory action research is on social change rather than production of new knowledge. And very important, action is being taken and change occurs. So this action learning is not a straightforward and linear process, but it's a process that involves taking action, observing, reflecting on that action to gain new knowledge and to revise a plan, and again, take action, observe, and reflect on that newly implemented plan. So then the research part. Regarding the research, participants study their own situation, and the researcher, the academic researcher, facilitates this. And participatory action research involves a mix of quantitative and qualitative methods. So in this case, children in the picture could decide to do interviews or to make a survey. Then I would like to give the word to Manou, who will tell a bit more about youth-led participatory action research.
Yes, hello everybody. So I'm going to tell you a bit more about youth-led participatory action research, which is one of the kinds of participatory action research that you can do. What you have in youth-led participatory action research is that you really collaborate with youth throughout the process of your research. And as Teatske already mentioned, in participatory action research, you equally collaborate with your participants. In youth-led participatory action research, that is with youth. So youth are also researchers, and they are actually co-researchers throughout the project. How YouthPAR is often implemented is that it aims to identify concerns in schools or communities. So often it is being used, for example, as a course in school, so children can really participate in improvements that can happen in their school. How we do it, which I will tell a bit more later, is that it's more in to improve the community. What you do in youth-led PAR is that you conduct research together with youth to understand a problem. So it can, for example, be that something is not really working in a school, or that you have problems in a community, and that you really are interested in the view of children on that. And by conducting research together with the youth, you really see the problem through their eyes. Because they ask, for example, different questions than we as researchers would do. By doing this, so by involving youth in such a project, youth become more empowered. They create more ownership over an intervention or an activity that you are developing together with them. And they also really become leaders in their community or in their school. So what is also very important is that together with the youth, you conduct the research, but also because in PAR the action component is so important, you really also develop something together with the youth. And they also really see the research being shaped into a product. Youth PAR is often used in communities of low socioeconomic position, because those communities can actually benefit most from, for example, being empowered and experiencing more leadership and ownership. And then through YouthPAR, you can achieve more social justice and equity in these kids. Now I will tell you a bit more about our research to give you an idea of how YouthPAR can work in practice. If you're interested in more information about our protocol, it's just being published in BMJ Open. And our study is called Kids in Action. Kids in Action is implemented in a low socioeconomic community in Amsterdam. As you can see on the picture, this is actually a map of Amsterdam. In red is the north of Amsterdam, and in dark red is the community where our research takes place. So it's really in the north in Amsterdam. It's a low socioeconomic community where you see a lot of multi-problem families, for example, because they have a lower income. Also, overweight and obesity is a big problem. And that is actually why we started our research there, because of the high overweight and obesity rates. But in general, our idea was that we wanted to improve the lifestyle of children in that community. And we already thought that overweight and obesity could become one of the main focuses because that was identified as a big problem. But we wanted to really get the view of the community in this. And the main goal was then to develop intervention in collaboration with the children of this community. So what was the study outline? We started with a participatory needs assessment in which we really wanted to look at what the main problems were in a community related to health of children. In this participatory needs assessment, we already participated with the community. We had participatory meetings with children in which they conducted their own research to look at problems that were experienced by their peers, but also by their parents in the field of health. We also did interviews with parents, and we also participated with parents in informal meetings to also get more of their understanding on the problem. And we also did interviews with professionals working in the community. Then based on that needs assessment, we looked again together with the children, what can we change, what needs to change, and how do you want to change that? Then together with the kids, we developed activities. And currently we are actually more in a process of evaluating the entire research and then also the activities that we developed and the process of how the project went. So how did the participation with children actually work? We participated with the 4 primary schools in the community. And the children that we worked together with are 9 to 12 years old. So in the Netherlands, that's the 3 highest grades of primary school. The project took 3.5 years, approximately 3 years. In year 1 and 2, we had a participatory group that we worked together with at each school. So we had 4 participatory groups that we worked together with. And those groups we called action teams. So the action team was a group of 6 to 8 children that would work together with us throughout the year to work on this project. We came together once a week or once every 2 weeks to work on the project. And then in year 3, that's this year, we have 1 action team with children from all 4 schools. So year 1 and 2, we had 4 teams. Now in this year, we have 1 team where kids from all schools are combined. And what is really important in these participatory groups is that children speak for their peers. So we have a selection of children that we actively collaborate with, but they are really encouraged to also get the opinion of their peers, their classmates, because of course it's not only the 6 to 8 kids that we work together with have an opinion, so we would also really like to hear the opinion of the other kids. And with these children, we work together in the entire process. So first the problem identification, then the development of activities, and the children also collaborate in the evaluation of the activities in the process. here are some of the results of the participatory needs assessment. So once again, in the beginning of the project, we started with the idea that we wanted to improve lifestyle, but we didn't really have a specific focus yet. These are some of the quotes that came from the needs assessment. The first one, I signed up for basketball, but I wasn't selected. That means that in the community you have a lot of sports activities that are being organized by the local government, but they have a maximum amount of children that can sign up. So this means that not all children can always participate in the activity of their choice. This was a quote from one of the kids. The second one is also a quote from one of the kids who said, I used to play soccer at school, but that stopped. Now I don't participate in any sports activity. Again, this is a similar activity as the first one. So not only does it have a maximum amount of children that can participate, but it also has a limited amount of time. So those activities are, for example, for 10 weeks, and then the activity stops and a new activity begins. But if, for example, you're super enthusiastic about soccer and you actually want to participate in soccer the entire year, that's not always possible. And in this community, it's also the case that not all parents can are financially capable of paying the membership of a sports club. So parents and children are actually very dependent on the activities that are being organized by the local government. The third quote is from one of the teachers who said, what is too far? Because when you have to go by bicycle, it's already too far. And that means that you have a lot of sports activities or outdoor activities that are being organized, for example, by the local government, but sometimes it's being organized at another school than the school that the child is in. And then it's already being perceived as too far because everything has to be in walking distance for the parents to be okay with it, and also for the so it's easy for the children to go there. And the last quote is from one of the kids who said 5 cans of Red Bull is not normal, 1 a day is enough. Well, we as professionals would already feel that 1 Red Bull a day is already quite a lot. For children, 1 Red Bull per day was fine. So these are just some of the quotes that we got from the needs assessment. But based on the needs assessment, we also together with the children decided to focus the rest of the project on 2 main behaviors. That was the promotion of physical activity and to promote healthy dietary behavior. And the dietary behavior mainly focused on consumption of sweetened beverages and lower consumption of unhealthy snacks. So then the needs assessment happened. Next thing was that we wanted to develop activities together with the children. We did a lot, so it's not that we came up with one intervention, but we actually had a lot of them. This is a selection. The first one is that at one of the schools, they started with a water policy. That is that children can only drink water at school. And that actually was because the children of that school, they really saw that a lot of the children at their school drank sweetened beverages, while at a lot of other schools in the community, they already had a water policy. So the children said, well, why don't we have that? So they went to the headmaster of the school and discussed that. And then the year after, the water policy was introduced. So it really was the idea of the kids. The second is that we started with cooking workshops. That was because from the needs assessment, we really found out that more knowledge was needed about healthy dietary behavior, but children said it has to be in a fun manner, because if you just do a presentation, for example, children perceive it as very boring. So they said, for example, if you do cooking workshops, I mean, everybody loves cooking, they love eating. So, but while doing the workshop, you can also really learn the children a lot about healthy eating and drinking. We also did a lot of extra after-school sports activities and also games, because not all children were interested in sports, but they also really like to learn more games that they just could play outside after school. Very important was that these activities had to be organized close by, because as we saw from one of the quotes, distance is a limitation for children to participate in activities. It has to be affordable, because otherwise not all children can participate, and it has to be supervised. That was mainly what we heard from parents, is that parents feel way more comfortable if they know that an activity is supervised by an organization that they know. And also children said that it's very nice if an activity is supervised, because then they have less fights. Also, we organized Bon Olympics, which is an Olympic sports tournament for all the 4 schools in the community, with a training program for 2 months, so children can also already train for the Olympics. And this intervention was developed because children wanted to have more competition between schools, and they wanted to have more sports tournaments and more after schools activities. So we joined all of these ideas together in the Bon Olympics. The Bonne is the community that we work in, so that's why it's called the Bonne Olympics. And children also, this is actually what we are currently working on. Children want to make a scary movie, which they think is fun, and they want, via the movie, they want to teach children more about sugars and how bad sugars are. So sugars are the scary part of the movie. We're currently still working on that one. Now, in general, some of the advantages of youth-led participatory action research. These are advantages that we discovered, but which you can also find in literature. It increases the feelings of participant ownership, because participants are involved throughout the process of developing an intervention. Actually happens when it is actually implemented. Participants are very proud of it, and they feel really part of the intervention, and they also feel ownership over the intervention. The second one is that youth describe their experiences, because they also do research. They also involve other children in this research. So you really see problems, and you really see how children perceive the community through their eyes. So that's very valuable information if you want to develop activities for youth. The third one is that it increases the likelihood that the resulting problem meets the needs of youth, and that the resulting program is actually context appropriate, because youth are, again, they are involved throughout the process. So the other end is that adults, for example, think about of a program, but then it's not always something that youth would actually like, and you don't have the involvement of the community. So then it could also be that it's not appropriate for the local community. Another benefit is that youth can reach their peers and also inspire professionals. So what we really saw is that if an intervention or an activity is organized by children, and the children are very enthusiastic about what they came up with, they spread the word, and they tell all their friends, and they really ask all their friends to join in an activity. So it's way more easy for youth to actually reach their peers, and to get more children involved. And because youth are so enthusiastic, and because it's so cool to see that youth have very good ideas, this also inspires professionals to also get involved in an intervention or an activity, and also for professionals to ask the opinion of children more, because they really see that it can benefit a program and also the enthusiasm of children. And lastly, participants become empowered, they develop skills and confidence, and they also gain more knowledge and information. And this is really something that you see throughout the process of working together with children, that because they are part of a project, because they learn more about research, because they have to speak for their peers and also get the opinion of their peers, is that they learn so much, they get empowered, they get way more new skills, which is really beneficial for the children as well. Then we also have disadvantages, of course. If you do like a classic research, it's a bit more clear about what your end goal is and how you get there. In youth-led participatory action research, this can be a struggle because you, from the beginning onwards, you're not clear what the problem maybe even is, what you're going to focus on, but definitely the interventions or activities that you're developing can be very different than what you expected in the beginning. And also, it is a very time-consuming and money-consuming process because you collaborate with youth every week, which costs a lot of time. And also, you're very dependent on children and also their behavior. Sometimes we had a meeting, but children were just so tired from school, or their attention was just somewhere else, and then you just really have to be flexible and also go with the flow sometimes because they're children, and it's already very great that they want to participate in the project. Also, you're very dependent on schools and parents. For us, especially when we had the action team, so the teams per school, we had the meetings at school, sometimes during school hours or sometimes also after school hours, but you are very dependent on the schools, and they really have to work together with you. And yeah, if you don't have a good relationship with the schools or with parents, then it becomes really a challenge. Then lastly, some conditions. If you want to do a youth-led PAR and also have a successful project, is that you need to have trusting relationships with everybody involved. So that's the children, of course, they're very important, and they really have to feel comfortable around the people from the project. But also parents, they have to trust you with their children, and they have to see the benefit of their children being participants in the project. And what I just mentioned, also schools are a very important stakeholder in the project. It's very important that you have training or capacity building for the children, because they are going to do research. So of course they also have to be trained in what kind of research they can do. For example, with us, they did interviews, they did questionnaires, they took pictures in the community, but they need to know, for example, how to pose a good interview question. And training and capacity building can also be for the facilitators. Maybe you don't have experience working together with youth or in facilitating in general. So that's very important to think about. A good organizational structure is very important. This one is a bit comes together with the last one, that you need to have a strong relationship with community stakeholders. It's very important that in the community you work with, that you really work together with every partner and possible stakeholder. Because if children, for example, come up with a really cool intervention, of course it also has to be developed and implemented. Children do not have all the skills or network maybe to really implement that. So whoever wants to work with you, or whoever you want to work with, really get them involved and make sure you have a good relationship with them. Also important is to have a strong administrative support and adequate resources. As I already mentioned, it is a really time-consuming process. So it's really worthwhile to have the resources necessary. And lastly, skilled facilitation to really get the most out of the meetings with children. This was the main presentation that we have, but we really would love to hear some of your comments maybe, or ideas about the project. We have some questions that we want to pose, and if you want to get involved, please react through the Q&A, and we can have a little bit of a discussion.
Yes, and I would like to propose the first question. I already mentioned in the beginning that PAR is focused on social change rather than obtaining new knowledge. But for us as scientists, it's also really important to know if such a project works. So have the behaviors indeed changed, or how is the process indeed what we expected? Have we given children indeed a voice in the whole project? So we would like to propose the question to you: how should we implement an effect and process evaluation in a YPAR project? So we were really curious if you had any ideas about this. Oops. So no ideas yet. So maybe I will just show you our next slides, because obviously we already implemented the process and effect evaluation. So for the effect evaluation, we conducted a control trial in which we included intervention children, so from the 4 intervention schools in the Banne, and we also included control schools, 4 control schools from a similar neighborhood. And we evaluated behavioral outcomes. First of all, the consumption of snacks and sugar-sweetened beverages, and also children's physical activity and sedentary behaviors. And we measured those variables at baseline, after 1 year, and after 2 years. But besides the effect evaluation, we also conducted a process evaluation. First of all, to see whether the development and the implementation of the interventions, how that worked. So it's a sort of normal process evaluation. But next to that, we also wanted to know how the children perceived the YPAR process. So we also wanted to know what they thought about being involved in such a project, and if they have the idea that their voices are being heard. And finally, we also wanted to measure empowerment, because the idea of participatory action research is that you get empowered and you feel that you have an increased control over your life. So these are important aspects we want to address. And we would be really curious if you would have some additional items or some comments on this. So no questions so far. We see 2 questions. First of all, maybe the first question: what steps did you take to gain parents' trust, and what, if any, roles do parents play in the YouthPAR process? I think maybe Manou can elaborate on this one, because she did try to gain the trust of parents.
Yeah, so in the beginning, when we did the participatory needs assessment, we really tried to include parents as well. We actually also wanted to do a participatory setting with parents. So we wanted to have also a parent group, which we would include throughout the process. So also in the needs assessment, and then also develop activities together with parents. But in the beginning, it was very difficult to find parents that wanted to collaborate with us. So what I eventually did is that I went to a local hairdresser in the community center, where a lot of mothers from the community came to get their hair done, but also just have a coffee and a tea. So I went there, I think for about 2 months. I went there every week. to just chat with the mothers there. They did know who I was and that I was doing research, so they knew why I was there. And they were very happy to chat with me about everything, about the problems that they experienced with their kids. But for them really to be part of research was something that they were not interested in. So for the needs assessment, we did get a lot of valuable information from parents through those informal meetings at the hairdresser. But we did decide that after the needs assessment to let the focus on parents go a bit. So we still try to include parents through kids. So for example, if children develop an activity, we really try to encourage them to involve their parents, to also get the opinion of their parents, and to really get the parents to the activity. So also, for example, to the cooking workshops, we really stimulated parents to come and pick their kids up and join the meal at the end. But we did feel that if we wanted to really include parents throughout the project, we needed to have way more resources than we had. So that's mainly how the involvement of parents now works.
Yeah. And another question is here on what does your sugar-sweetened beverages intervention consist of? I think it's good to realize that we don't have one intervention, but the aspect of sugar-sweetened beverages is captured during the cooking workshops a bit, and also in the scary movie it will be addressed. And we measure the effects. That's the next question. How did you measure the effect? We measure that by a questionnaire at baseline after 1 year and after 2 years. And that questionnaire addresses the amount of sugar-sweetened beverages, all kinds of sugar-sweetened beverages. So juicy drinks, soft drinks. So yeah, that's how we try to measure the effects. Another question is about tokenism. Tokenism seems to be a common issue in YouthPAR. How do you recommend avoiding tokenism while still achieving research or funding objectives and outcomes?
Yeah, this is I really understand the question, and it also has to do with where on the ladder of participation your research is. So we try to be above tokenism because we really try to include the children throughout the process. So not only, for example, use them to get our information and then that we do something with the information, but we really try to include the children in the entire process. So in that way, we definitely try to avoid that. And I think very important is to realize how valuable the information is that you get from the children, and also really say that out loud to other professionals. So what we really see in our community is that also the local government is very involved throughout our project, and they actually ask the opinion of our kids for issues that they have, because they really see how well the action teams are involved in the project. So the local government also, and also other professionals in the community, they really see how well children can actually be involved in decision making. So I think it's very important to not only have the collaboration and participation of children on the agenda in your own project, but also try really to get it on the agenda of the professionals, the stakeholders that you work with, to really try to avoid that children or other participants are just seen as objects where you can get information, but that you really make everybody around you realize that it's very important to get them involved in every aspect of, in our case, intervention development, but also other stakeholders, they also develop a lot of activities, for example, in the community, and they also now see the value of involving children in the entire process.
Good questions.
Yeah.
Any more? Or is there maybe anyone who wants to share how, for example, empowerment could be measured, maybe, because that's really difficult to measure aspects of empowerment, for example, in youth. So there are no measurement tools to do that. So we were also curious if you had any ideas about that. And meanwhile, maybe also go to the final question, whether there's anyone who already uses YPAR in the research, or maybe would like to use YPAR in the research project. And what would be barriers to do it, or facilitators? No more questions?
Hi, Teatske. I might have a quick question. I can't type it, so I'll just speak up. We talked about the parents and how you can involve them and gain their trust, but how about the children? How do you work on building rapport with them? Is that easier than with parents, or is that maybe the hardest part? Can you elaborate on that a bit?
I think you need a playful facilitating researcher, such as Manou.
Yes, I think it definitely helps that I'm quite informal myself. I think that really helps to level a bit with the kids. What also helped a lot for me is that our project is a collaboration with the Amsterdam UMC, but also we work together with an after-school daycare, which are really focused on sports. And I also had like how do you say it? We had a sports camp for children with obesity. And my colleagues from the daycare, they facilitated that camp, but I actually went with them for a couple of weeks, and it really helped me to see how they work together with kids. And my colleagues from the daycare, they did like the teaching, how do you say that? The
teaching education.
Yeah, so they are very experienced in teaching, in facilitating groups, and they are so strong in that I really learned a lot from them in how you can, in a playful manner, collaborate with kids, but still be strict enough to really get the things done that you need to get done. And also that, of course, children also need rules and they need guidelines. So it's very much finding a balance in that. And what also really helped is that with some of the action teams, we also had a sports activity after like the formal meeting that we had about the project. We ended with a fun sports activity. So then also you really get way more bonding with the kids, because you play tag or hide and seek, but then you really get a different kind of vibe with the kids. And also it's a lot of time investment, as in I was at the community a lot. So it's just children, but also parents, they saw me in the mall or at the community center or at the hairdresser or just being at the school. So they really got to know me. And I also think that's very important to gain trust of the entire community, that they just see you a lot. So they not only see you as the researcher, but they also just see you as a person that is in a community. And then when you just have an informal chat, you ask how it's going with the kids and with the parents. That's just a very valuable way of interacting with them.
Yeah, and maybe it's also good to mention that so the process of developing and implementing intervention is a quite long process, but we aim to already implement small activities already in the first year of our projects. And that's as a researcher, you want to wait because you want to be sure that it addresses the right determinants and the right behaviors. But for children, it's really important to already see that something is happening. So I think that's also very important to keep children motivated during the whole process. Any more questions? Maybe meanwhile, it's also good to let you know that during the ISBNPA meeting in Prague, we also have a community research symposium. From the top of my head, I thought it was on Wednesday. So if you want to know more about participatory action research, please find us in Prague. Small advertisement. Maybe wait 1 minute to see whether you have more questions coming up. And we see now that we already have an answer for measuring youth empowerment. So thank you very much for that. And then if there's no more questions, then we would like to thank you all for joining us.
Yes, a big thank you to our speakers as well. Thank you very much for speaking in our webinar, The Children and Families SIG of ISBNPA. Thank you to our attendees, and great to see that this research has taken off and that it's being recognized beyond research. That PAR is a great way to collaborate with children and parents. Hopefully see you all in Prague until our next webinar. Thank you.
Thank you.
Thank you. Bye.